Hi friends, it's Rebecca, and I want to show you how to use the CDC's COVID data tracker to find information about your local community spread and hospital use, vaccination rates, and other information about COVID on the ground where you are so that you can make informed choices about your risk and the risks you're taking for your family. So you can start by just putting in CDC COVID data tracker into your search engine. Once you find it, I recommend bookmarking it so you can always come back to it. The top part includes information about the whole US, but we're interested in local community information. So type in your county there. I'm going to type in Hardy County, Kansas, because that's where I live. And notice we're going to scroll down to the integrated county view, and the default information, the top information, the default of the map down below is what's called the COVID-19 community levels. It also is in the biggest print there. The CDC wants you to know that that is important. I want you to know that that information is probably not what you're looking for. Most people, when they want to know what's COVID like in my local community, what's it like on the ground, how much of a risk is it if I go to the grocery store, if I choose to be unmasked, if I ride public transportation unmasked, how much COVID is actually out in my community and how likely am I to run into it? Well, the fact is right now, and as it has been for weeks and weeks and weeks, most counties in the US and most people in the upper 90% are in communities where there's a high level of transmission. So I want you to know that community level is not transmission level. Community level is not transmission level. Community level is a combination of transmission level, hospital beds that are available, hospital beds occupied by COVID patients. And for most of us, that is not the information that we use to make decisions about our behavior, like if we're going to wear a mask or not, or if we're going to go to a crowded venue or not. So the CDC puts that front and center, and they make it the default on their map. That's an unfortunate choice because it is deceptive and it leaves people without the information that they're typically seeking. What most people are seeking is down below, the weekly metrics used to determine the COVID-19 community levels. Most people are looking for this number. What is the rate of COVID in my area right now? And 75.52 is my local number, and that is a large number. The CDC's definition of low numbers is under 10 or under cases for a low number of cases. The new hospital admissions per 100,000, and then the percent of inpatient beds used by patients with confirmed COVID-19. Those are the other numbers that create that community level number, but that is really, these two factors, unless you are managing a hospital, are probably not your main concern. Your concern is how much COVID is there in my community? How many people am I going to run into with COVID if I go to a public space? Is it a lot of people who have COVID out there right now or not? And again, in most of the US, it is a lot. The map defaults to the soothing green tones because it's that community COVID community level. We want to change it over to transmission. Look what happens when we look at transmission level. Wow, that's really different, isn't it? That's because transmission level is very high across the whole country. You can change to look at other kinds of information. We can see how many cases are happening in our county. So right now in Hardy County, we've got 20 reported cases. Again, reported is a way undercount because at-home tests are not reported unless you choose to report those to your doctor. Some counties, not my county, but some counties do have a health department hotline you can call to self-report a positive test. But not all counties do. So you can check if your county does. What percent of tests that people are taking at testing centers are coming back positive? Of course, we've shut down a lot of those testing centers. So a lot of this information, again, is going to be a real undercount. Our percent positivity here is, in my county, is 8.52. The CDC says under 5% is low. So we are not low there. Deaths. When you see a death as reported deaths as listed as suppressed, that means it probably means that there has been a death, but that you're in an area of a low enough population or there have been few enough deaths that they're not going to tell you the number because it would reveal identifying information, right? So if you live like I do in a mostly rural place, you know who died last week, you can look at it in the newspaper. They don't want you to be able to open up the newspaper and know the cause of death. That might be, it would be COVID in there. So that information will be suppressed. Eventually it does get released in some ways that protect privacy. Hospital utilization. How are your admissions to your hospital for COVID? Vaccination. What percent of your population over age 5 is has received the most recent booster? 16.1% in my county, slightly above our national average. Sadly, it's a real failure to get shots in arms. The CDC's Social Vulnerability Index is a measure based on I think 14 different areas of concern, and broken down into 4 major themes about poverty. There's questions about poverty, education, health, how many young children, how many old people. And it's a question of how much, it becomes a measure of how many resources the CDC thinks that your community is going to need to stay healthy and well. And so it generates a number from 0 to 1. And you see that as Harvey County. I want to flip over real quick to another similar index, the Pandemic Vulnerability Index. And you see this comes from the NIH. And you can find your own community's Pandemic Vulnerability Index by going to this website. Type in your county name. I typed in again Harvey County. There we are. And this breaks us down again by census tract. It's about as fine of information as we can get. That's smaller than an area code. It's smaller than a zip code. It's really kind of neighborhood by neighborhood. And it considers all the things that could make a community really vulnerable to a pandemic and to not recovering well from a pandemic. So are you protected in the first place, and are you resilient so that you can get healthy afterwards as a community? And that comes from a number of questions, and you see they're kind of graphed over here in this circle graph. And so the bigger you're part of the pie, the bigger that factor is. So in Harvey County, where I am, again, this goes from 0 to 1, we're at 0.4, about in the middle of the country. You see that over here as well. This is our color blue. We're somewhere in between the 40th and 60th part of the country. And this is our rate. We're 1,744th out of all the counties in the US. And if you pop down below, you'll see the kinds of questions they're asking, like how fast does disease spread? How mobile is the population? How dense is the population? Right? A pandemic is going to hit harder in a really urban area where people are living in apartment buildings versus in rural areas. How much testing is happening? How much air pollution? That's something that the pandemic doesn't cause, but when a pandemic hits, makes you more vulnerable. How old are people? How sick are they going into this? What are the health disparities? So you can look over there if you want pandemic vulnerability. The CDC's social vulnerability ask questions beyond the pandemic. And then look at this. Community transmission. That's the number you were looking for, right? When you said, I want to know how much COVID is out in my community, that's the number you wanted. Note that the CDC does not put this drop-down menu in alphabetical order, nor do they put this drop-down menu in the order that people are most curious about, right? Most people are not curious about what percent of tests are coming back positive or what percent of my county is vaccinated. They're looking for how many cases are out there, what is the rate of transmission. That is my real risk here. And this is where it lights up in red. And you can see that we have a substantial transmission rate right now in Harvey County. High is 100 or more cases, and lots of places in the US have been far, far above that 100 cases per 100,000 people threshold, like in the 2 and 3 and 4 and 500 cases per threshold per 100,000. We don't even have a color for rates that high. But anything over 100 is high. Most of the country remains in high or substantial, both in terms of county, but more important in terms of population. And so the danger levels from transmission remain very high. If you have questions about this, or you'd like to learn how to find other information about COVID so that you can make informed choices, please let me know.